Hello, and welcome to Psychology 111. This presentation will cover the topic of human development. The presentation will answer the questions shown, beginning with the question, what is developmental psychology? Developmental psychology is the branch of psychology that studies the changes in physical and psychological functioning which occur from conception across the entire lifespan. Sometimes these changes involve gains. For example, children gain in height and weight as they get older. And sometimes these changes involve losses. For example, adults gradually lose the ability to hear high-frequency sounds as they get older. Similarly, the changes that people go through are sometimes due to natural processes. For example, it is natural for people to grow bodily hair during puberty, and sometimes due to life choices. For example, a person who chooses to go to the gym would develop more muscle than a person who chooses to remain sedentary. Developmental psychologists often engage in normative investigation. Normative investigation establishes the average characteristics of an age group, for example, the average height of 5-year-olds or the average weight of 12-year-olds. This allows psychologists to distinguish between a person's developmental age, his or her chronological age. For example, normative investigation has shown that the average weight of 12-month-old females is 20 pounds. Thus, a 10-month-old female who weighed 20 pounds would have a developmental age of 12 months, but a chronological or actual age of 10 months. There are two methods that can be used to detect developmental changes over the lifespan. One method is the cross-sectional approach. This involves measuring samples of people of different ages. For example, measuring the height of some 10-year-olds, some 20-year-olds, some 30-year-olds, and some 40-year-olds, etc. The other method is the longitudinal approach. This method involves remeasuring people over time. For example, measuring the height of a sample of people when they are 10 years old, measuring the same people again when they are 20 years old, again when they are 30-year-olds, and again when they are 40-year-old, etc. The next question to be addressed is, what is physical development? Physical development is the maturation of the brain, the body, and motor skills. Brain development follows the back-to-front principle. Broadly speaking, structures towards the back of the brain mature earlier than structures towards the front. For example, the brainstem is fully developed at birth. The cerebellum is fully developed by about 1 year. The sensory areas of the brain are fully developed in the first 2 years of life. The amygdala is fully functioning by 6 years. Language areas of the brain take about 6 years to mature, while the prefrontal cortex is not fully mature until the early 20s. The density of synapses in the prefrontal cortex peaks at 2 years, allowing children to form memories. There are major changes to the structure of the prefrontal cortex that continue from middle childhood to early adulthood that allow for logical thought. Body and motor skill development follows two basic principles. The cephalocaudal principle holds that physical and motor skill development follows a head-to-toe progression. That is, growth and control of the head precedes growth and control of the body, which precedes growth and control of the arms, which precedes growth and control of the legs. The proximodistal principle holds that motor skill development follows a centre of body outwards progression. That is, infants will first learn to control their torsos, then their arms and legs, and then their fingers and toes. The third question to be addressed is, what are the stages of physical development? For ease of instruction, this presentation will break down physical development into 4 stages. The first stage of physical development is the prenatal stage. The prenatal stage consists of 3 substages. The germinal period of prenatal development, the first 2 weeks of pregnancy, begins when an egg produced by the ovaries of the female parent is fertilized by a sperm produced by the testes of the male parent. A fertilized egg is called a zygote. The single-cell zygote rapidly subdivides as it passes down the fallopian tube, dividing into 2 cells, then 4 cells, then 8 cells, etc., reaching 128 cells after about 1 week. This cluster of cells is called a blastocyst, and it is surrounded by a layer called the trophoblast, which provides nutrition. In about 80% of cases, the blastocyst passes down the fallopian tube and successfully attaches to the uterine wall. In about 20% of cases, the blastocyst does not attach and the pregnancy ends. The embryonic period of prenatal development lasts from week 3 to week 8 of pregnancy. In this period, the blastocyst transforms into 3 entities: the embryo, the developing life form, the amnion, a fluid-filled membrane that encloses and protects the embryo, and the placenta, an organ between the embryo and the uterus, which transfers in oxygen and nutrients from the mother's blood and transfers out waste products from the embryo. During this stage, vital organs such as the heart, brain, and spinal cord begin to form. At the end of the stage, the embryo is only about 1 inch long, but it is starting to look human. Should be noted that teratogens are harmful agents such as disease, infection, and toxic substances such as drugs and alcohol, etc. Teratogens can be passed from the mother to the developing life form. If teratogens are passed to the developing life form during the embryonic period, the consequences can be very severe or even fatal. This is because the teratogens will be affecting the development of the vital organs. The fetal period of prenatal development lasts from week 9 to week 38 and above of pregnancy. During this period, refinement of the facial features, hands and feet occurs, and the various senses develop. Spontaneous movement of the developing life form can occur as early as 8 weeks. However, movement is not normally felt by the mother until about 16 weeks. The fetal period is also a time of rapid brain growth. Up to 250,000 neurons can be added per minute. A full-term pregnancy lasts 38 weeks. However, birth can occur before this time. A fetus becomes medically viable, that is, it has a 50% chance of survival with medical support, at 24 weeks. Infancy and childhood last between birth and about 11 years. Newborn infants are called neonates. When infants are born, they come equipped with numerous reflexes that help them to survive. Among these reflexes are the rooting reflex. If something tickles an infant's cheek, the infant will turn its head in that direction. The sucking reflex. If something is placed in an infant's mouth, it will suckle on that object. The grasping reflex. If something is placed in an infant's palm, it will grip that object. The Moro reflex. If an infant feels like it is falling, then it will throw out its arms and legs and rapidly bring them back together again, as if trying to grab hold of something. The tonic neck reflex. If a lying down infant's head is turned in one direction, then it will extend the arm on that side. And the stepping reflex. If an infant is held with its feet touching the ground, it will move its legs in a marching motion. There are also many other reflexes. When infants are born, their senses are developed to varying degrees. Infants' sense of touch is highly developed. They are especially sensitive on the lips and around the mouth. Infants' sense of smell is highly developed. They learn to recognize the smell of their mothers very quickly. Infants' sense of hearing is fully developed. They can recognize their mother's voice from birth, as they have learned it while still in the womb. Infants' sense of taste is good. Infants prefer the taste of sweet things. This serves an adaptive purpose, as sweetness is associated with high calorific content. Infants' vision is very poor. Acuity is 2600 at birth. Infants can see at 20 feet what an average person can see at 600 feet. However, cones develop rapidly over the first few months of life, leading to a quick improvement in vision. 20/20 vision is reached at about 6 months. Infants cannot use a standard eye test chart. Instead, their vision is assessed using the habituation technique. Infants who see a novel stimulus pay close attention to it, and as a consequence, their heart rate goes up. The habituation technique shown in the slide presents a stimulus on a screen at a particular distance, then changes that stimulus. If the heart rate of the infant looking at the screen goes up when the stimulus changes, then it is inferred that he or she was able to see the change at that distance. Infants' depth perception is also poor. The ability to perceive depth develops between 4 and 6 months. Infants' ability to perceive depth can be assessed using the visual cliff. The visual cliff consists of a glass-topped table. On one side of the table, a cloth is placed immediately below the glass, making that side appear solid. On the other side of the table, the cloth is placed on the ground, making that side of the table appear like a vertical drop. An infant's heart rate will decrease if it detects something interesting. If you place an infant of less than 4 months of age on the vertical drop side of the cliff, then his or her heart rate will not change. If you place an infant older than 4 months on the vertical drop side, then his or her heart rate will drop. This indicates that they have detected something interesting, that they seem to be above the ground. From this, it can be inferred that they have the capacity to perceive depth, but haven't yet learned to fear falling. Infants who are old enough to crawl, about 6 to 8 months of age, when placed on the solid side of the table and encouraged to crawl across the vertical drop side, will stop at the edge, indicating that they can both perceive depth and have learned to fear falling. If placed on the deep side, the heart rate of 9-month-old increases. This is a fear response. Adolescence lasts between about 12 and 20 years of age. During adolescence, individuals go through puberty, the attainment of sexual maturity. Individuals develop secondary sexual characteristics. Changes occur to the voice. The larynx grows, causing the voice to deepen. The larynx grows more in males than females, usually producing a visible Adam's apple. Hence, the male voice deepens 1 full octave, while the female voice deepens only a few tones. Downy vellus hair transforms into thick and dark terminal hair. This is known as pubarchy. This happens on the arms and legs and in the underarm, pubic, and face regions. Thickening of the hair on the arms, legs, and face occurs more for males than females. During puberty, females develop breasts. This is known as thelarchy. During puberty, males and females also become capable of producing sex cells, gametes. Males go through spermarchy. They become capable of producing viable sperm, while females go through menarche. They become capable of producing viable eggs. During adolescence, the brain also undergoes numerous changes. At the start of puberty, a surge in sex hormones, such as testosterone and estrogen, triggers changes to numerous areas of the brain. The prefrontal cortex undergoes synaptic pruning. That is, connections between neurons that are used often are strengthened, while connections that are not used are lost. This improves the functioning of the prefrontal cortex, the PFC, thus increasing the individual's ability for planning, decision-making, emotion control, and impulse control. This process takes until the mid-20s, so teenagers are notoriously poor at these things. There is an increase in the number of dopamine receptors in the striatum. This makes adolescents more sensitive to rewards. Thus, teenagers find excitement, novelty, and risk much more rewarding than children or adults. This is highly useful because teenagers are preparing for independence, so need to go out and try new things and gain experience. However, it is also problematic because teenagers find cigarettes, drugs, and alcohol more rewarding than adults, which makes them susceptible to addiction, particularly at a time when they find impulse control difficult due to an underdeveloped prefrontal cortex. There is growth to the amygdala, which makes adolescents highly sensitive to emotional cues, such as facial expression. This accounts for why teenagers are often angry or embarrassed. They often misread facial cues, making them feel that people don't like them or are laughing at them. This can lead to temper tantrums because teenagers cannot control their impulses. In addition, there is a surge in myelination, the insulation of neurons, which occurs throughout the brain, which speeds up transmission of information, thus improving brain efficiency. Hence, adolescents can process much more information than children. The final stage of physical development is adulthood. Adulthood extends from approximately 21 years of age onwards. During early adulthood, physical appearance begins to change. For example, people develop wrinkles on the forehead and laughter lines around the mouth and eyes. During middle to late adulthood, biological functioning begins to decline. For example, at about 40 years, the lens of the eye becomes less flexible and starts to yellow, causing a deterioration of vision. At this age, the sperm count of males also begins to decline. At about the age of 50, females go through the menopause. They stop ovulating. Age-related hearing loss is very common over the age of 60. 30% of Americans aged 65 or over have some degree of hearing impediment. This is largely due to presbyscusis, a degeneration of the cochlea causing reduced sensitivity to high-frequency sounds.